Message. Job done. 131 people just got texted.
Okay, let's see how it goes.
I'm going to quickly jump onto Facebook and just let everybody know that we are no longer on Facebook for this session.
And we could do, like I said, we could do the next one. I mean, I think we can run through this in 25 minutes.
Yeah, do a short session on the other one.
Yep, nice. And we'll record this and we could do one live. Okay.
Sounds good.
And let's see if I can make you the host. Perfect. Okay, so I've got some people coming in right now, and I'm looking forward to starting this. Okay.
Yeah, let's get started.
Davide, why don't you do the introduction, and then I'll introduce you as well.
So, welcome everybody. It's really great to have everybody jumping on right now. So, I see we got James Garrett, Dr. James. Welcome. Joining on this call, got iPhone. Not sure who you are, but welcome. Zach, welcome as well. Great to have you all jumping on right now. We're probably going to have a good number of people joining us today. Very excited that you're joining us for an update on the free CE. Very, very exciting. Something that has been sponsored by Softwave. So thank you to Softwave for doing that. And just one quick thing I'd like to do before we continue. Just wanted to say, if you are jumping on for the free CE, and I'll remind everybody at the end as well, if you are jumping on for the free CE, we do need you to register and give us your chiropractic license number and a few other things so that we can make sure that we get you registered with the chiropractic boards all across the US, depending on which state you're from. We've got to do a whole bunch of work in the background. So I'm going to put a link in the description or in the chat here in Zoom. Please jump on that link and give us some of your chiropractic information. That helps us so much. So again, welcome everybody joining. Matt Thompson, Dr. DeBernardis, great to have you on this Zoom call today. And I'm going to also introduce, obviously, I don't know if Dr. Matt DiDuro needs any introduction. He's a pretty amazing doc. And Dr. Matt has been a chiropractor for 28 years, has seen a lot of amazing stories of people just lives getting changed. I'm sure many of you joining right now who are on this Zoom, also had greatest stories. Well, Dr. Matt comes with a wealth of experience and knowledge in so many different areas of the chiropractic space, specifically also with shockwave technology and Softwave. He operates an amazing clinic out of Atlanta called the Atlanta Pain Institute. And so we're going to get a lot of great wealth of experience today as Dr. Matt just shares with us. So Dr. Matt, thank you so much for being on this Zoom call today. Thank you so much for joining us. Please share a little bit more what's on your mind right now.
All right. Well, as you guys know, I'm an Italian American. I'm from New York, and I'm pretty. I get emotional about this, and I'm as a chiropractor, as a doctor, we're educators, and that's really what this is all about: is educating the doctors in our communities about the differences, because everybody's out there telling you they got the next best thing, when in fact they may be selling an inferior product or a device that hasn't even been cleared in the USA. So you've got to look to the experts in this field who are going to help you navigate. And that's what we've done over 700 times. I'm a chiropractor, like you said, for 28 years. The last 6 years, I've been working with Softwave as an influencer, as an educator, as the guy who developed a protocol called Less is More that's in over 600 clinics actively right now. And we're seeing thousands of patients per day with these protocols. So this is a presentation I did at the Toby, the Orthobiological Institute, a bunch of regenerative medicine doctors from all around the country that came in, and I was lucky enough to present this. So that's what we're going to do today. And we are going to talk about when nothing else works, really delivering an unfocused, low-intensity soft wave that stimulates the body's innate ability to heal and is working directly with your innate immune system. So let's see if this works. Yes, shock waves are around. They're in nature at all time, right? And this is that supersonic boom when you hear a jet go into overdrive. Mach 1 would be 765 miles an hour. And this technology, because the spark is generated inside of water, that sound wave is magnified 5 times. So that's where you get the 3,355 miles an hour. And that's exciting. This is literally like harnessing the power of a lightning bolt and thunder and putting it into a handheld applicator that you can point at the human body and really decrease pain, as well as stimulate the body's natural healing ability, specifically the innate immune system and toll-like receptor 3. We're going to get into that a little bit, but understand shockwave's been in nature, and I think this is probably one of the best things. Hopefully it plays. It might just be a picture, but this has been viewed over 2 million times on social media. It was from an episode that we did back in November 21st of 2019. We were on the nationally syndicated show, The Doctors. I'm not sure if it'll play, but I can send you a link to this episode. It's TikTok. It's done really well.
Imagine having an injury, but not needing to go into the knife or rely on addictive pain medication, yet you can be healed by shockwaves. That's the idea behind something called soft wave therapy.
These are happy tears. Holy cow. When I got off the table, I didn't feel the pain for the first time, I guess maybe in 12 years.
This is really a nice little breakthrough for me. It really, truly is. It just brought back life to me that I had been without for so many years.
How was your experience using this device?
My experience has been life-changing. This has been a really amazing thing.
So it's nicknamed the stem cell machine. The idea is that it uses shockwaves to recruit the body's own stem cells to help heal injuries.
It's very good.
How come? Tell me what's different about your hands.
I can move it, open it all the way. Like,
how long has it been since you've been able to do that?
20 years.
20 years!
Yeah. I think it's nice. I think it works better on the joints. Ooh, what's up? All right, don't over push it there. Man needs a knee replacement.
Well, I don't. There's no tightness in my back.
It's pretty cool, isn't it?
That's crazy. I guess I don't realize how much bigger when I walk.
But it is remarkable, and even the doctors that are looking at it are like, this is unbelievable progress. Listen.
Crying behind the camera.
Tomas said to me, why do you do this? Why do you go all over? Why are you in Vancouver? Why are you in Portland? Why are you? I'm like, because this thing is so transformational.
So that gives you an idea. Can everybody hear me okay? Yeah. So that gives you an idea, the power of this device, and it's intelligent energy. Again, it's like taking a lightning bolt in the clasp of thunder and putting it on that handheld applicator you see to the left. Now, the thing you have to understand is that this is genuine lithotripsy. This is the same technology they've used for 40 years to break up kidney stones, biliary stones, and salivary stones with an 85% success rate. The thing on the right, that's a radial device. It has a metal stylus that actually pounds into your tissue and creates trauma. Their circumference is, the treatment area is like a dime, where our treatment area is everything inside that yellow. It's the base of a soup can. And the depth of penetration with a radial device is 5 dimes. So it pounds on the tissue, creates trauma. Ours on the left is, again, genuine lithotripsy. It's using electrohydraulically produced supersonic sound waves that can penetrate basically the depth of this iPhone into the body and create positive biological effects. So as below, you can see our fingerprints between the different technologies. Ours looks like a cardiac wave. It has a high pressure, then followed by a low pressure. And we are the only device on the planet that has both a primary and secondary supersonic sound wave. So what that means, it's like you're standing on the beach and that first wave hits you, and that's positive force. But when that water sucks back into the ocean, that's a negative tensile force. It's almost as strong. Our researchers are hypothesizing that the actual positive biological effect is coming from that secondary wave. And we have over 133 peer-reviewed studies. The other ones, they don't. And you can see that's like a sine wave. It just goes up and down, much like an ultrasound, right? It doesn't have that high intensity. It's the clasp of thunder. It's that supersonic sound wave that's creating what's called mechanotransduction. And again, this is a good close-up of those. One is a pressure wave, and the other one is creates a supersonic sound wave. So even in the International Shockwave Symposium, I got to go back. They are not considering EPATs as true supersonic sound waves. So this is what we're looking at right now. The red is our fingerprint, and the blue one, as you see, is a radial ballistic type of device, and it's not able to generate those high pressure, low pressure waves. Okay. I don't want to get too deep into this because this is actually what we're going to be getting into the nuts and bolts during our continuing ed class. But the real theory that you have to get here is called mechanotransduction. And mechanotransduction is literally the compression of the cell and then expansion. So it compresses it by 2%, as you see, and then the expansion. And you can see how our fingerprint and what parts of the high pressure and low pressure is actually activating the cell membrane. So this is working on a cellular level. And that compression and expansion creates a shearing force and knocks off oxidative agents that build up on that cell membrane. So it improves the cell membrane permeability, and you get nutrients flowing in and waste products out. So it improves the health of the cell. Not only does it work at a mitochondrial basis, but that shedding, that shearing force also creates shedding of microvesicles, extracellular vesicles, messenger RNAs, and exosomes. Those are all helper cells to help bring in stem cell attractants and repair cells. So again, sometimes patients are giving this treatment and all of a sudden they're like, oh, I'm getting hot, you know? And it's like, that's their immune system kicking in. That's their defense mechanism. And they've never been hit by supersonic sound waves before. So it tricks the body into thinking there's a new injury without damaging the tissue whatsoever. This is an important concept, gentlemen, and ladies, that you have to understand. And this goes over, there's a physical, chemical, and a biological effect. The things you understand is that it improves circulation or angiogenesis by 300% within minutes of treatment. We actually have a class 2 clearance for tissue regeneration, connective tissue activation. That is the fabric of life. That is the building matrix of all your bone, tissue, nerves, adipose, skin, you name it. So there's not many companies in the world that have that class 2 clearance. So it helps really kind of reboot the whole cascade of regenerative healing. So even in an old injury, it starts that whole 10 to 12 week process again. I've got 2 people in the waiting room and I feel bad, but they're not going to be able to see this because I'm kind of stuck. All right. So this is just more of the different things. It actually helps regulate inflammation. And that, I believe, is what makes this a billion-dollar company. And you could still be considered pioneers because we've only touched into 0.5% of the entire healthcare in North America. So, I mean, there's only 1,300 of these worldwide. We have 700 here based in North America. And, you know, we're at Harvard, Mayo Clinic, Cleveland Clinic. This also reduces the inflammatory effects and helps with VEGF, vascular endothelial growth factor, that helps synthesize nitric oxide and helps create vasodilation. So you get this influx of blood and oxygen-rich blood. And this is really the different, right? This parabolic reflector is what allows us to go really to penetrate the depth of a soup can into the body. And everything in that soup can zone is a positive treatment area, where a lot of these other devices, it might be like that of a Sharpie. So you have to like pinpoint, they're called focused, and you have to pinpoint where that treatment zone is. For us, it's basically the bottom of that soup can. And we are patented, unfocused, low intensity, extracorporeal shockwave therapy. There's no trauma. And this is a very good illustration of that treatment zone in the depth of penetration. Is that coming across okay?
Yeah, that's great. Yeah, that's looking great.
Okay, good. Just letting some people in. Woo! So that's it. That whole treatment zone, that whole area, that soup can is creating positive biological effects. And it can work at a cellular level. Okay, so again, there's different types of technologies out there. I don't want to go get too deep into it. The radial, as you can see on the right, is working at a superficial level. It's penetrating the depth of 5 dimes. It's causing trauma. And then you see basically a focused shockwave in the middle. And then you see our unfocused technology that can go deeper and penetrate, okay? This is, most of us are using the yellow or unfocused that you see on the bottom. The top one, blue, is focused. It's a device that we have. It's more for non-healing fractures, but 95% of the ones in use in the United States are this yellow one or the unfocused. Again, here's our top clearances for this technology for class 2. So a lot of people can be registered as for class 1 device to help decrease pain and improve circulation. We've spent literally $10 million over the last 9 years to get this class 2 clearance, right? We're in a league of our own. Activation of connective tissue, we already said that's the fabric of life. Treatment of chronic diabetic foot ulcers, second-degree burns. This device will help thousands of people be saved from amputation. Pain reduction, improved blood supply are obviously the main thing that we're seeing with a lot of treatments.
Dr. Matt, talk about that one person in Austria. Or there was a trial that took place in Austria with 12 people that I think...
the wounds? For the wounds? No,
yes.
That was in Smyrna, Georgia. That was Dr. Marcus, who was basically a trauma center. I mean, she was we call them, amputation center, because we're in Route 20, Interstate 20, which is basically the diabetic corridor and the tornado corridor in the south. And what it does is, people get diabetes and then they got the sugar, and then they're, it's just common knowledge. Somebody will get an amputation, and that's, oh, my aunt had it, my uncle had it, so I have it. But in this Dr. Marcus study that was published in Stem Cell Regenerative Medicine, basically all 11 people were scheduled for a amputation. And They agreed to be part of this study. Now, one of the people had heart issues and had to drop out, but the other 10 people that finished the 6 sessions, none of them had amputations. And again, this is a pressure ulcer that had been there for years. And this is a treatment after, they had already lost 2 digits in their metatarsals. So it's like this saved the person from having a below the knee amputation. The ones on the right, this is an MRI. The first one you see is a patient that actually had a non-healing fracture in their talus. And this is after 4 sessions over a 5-week period. It healed. This is care of Dr. Johns Mullins, 40 years as a plastic surgeon at Piedmont Hospital. These are unbelievable studies, but the cool thing is we are in 13 trauma centers in Europe. We have saved the Austrian workers' comp system over 70 million euros in the last 10 years just on non-healing fractures. And understand, non-healing fractures become osteomyelitis, which is infection in the bone and usually lead to amputation. Okay, beautiful pictures. Hopefully you guys aren't having lunch. This is the real deal, man. There's been over the last 40 years, there's been over 3,000 studies. Most of them are now coming out of the United States, which is beautiful. And we have University of California, San Francisco, Dr. Tom Liu, who his team is, they're world-renowned in urology, and they're the ones who are responsible for dozens of the studies that show we activate stem cells within minutes, 45 minutes within treatment. There's nobody else. He's got 2 of our devices. So this is an emerging concept. And I always teach my doctors, you have to watch the trends, right? History tends to repeat itself. And you can't be sitting on the sidelines, right? Those laggards, they're the ones that are just getting flip phones now, the people. But the early adopters and the pioneers, like Dr. Josh Nidings, who's on this, and Dr. Gerald, you guys are the pioneers. And these are the ones who proof of concept. And I'm just grateful to have people that trusted in this technology and believed in us. So it's very comprehensive. It's, let me get that back. Sorry. Basically, wherever you place this on the human body, you have a positive biological effect. We have Dr. Johannes Hofeld, who's a cardiac surgeon, internationally renowned, who has now done 67 bypass surgeries. And during open heart surgery, actually used our patented technology for 3 minutes on an open heart. And 1 year later, they've had a 10% improvement in left ventricular ejection fraction. Why is that important, Davide?
Tell me.
Well, because never in mankind has there ever been a cardiac regenerative technology. I called him the Elon Musk on one of our interviews because we're making up new words that never were capable. If you have a heart attack, which unfortunately my dad passed away from a terrible heart attack, your heart doesn't repair. And so you fall into what's called congestive heart failure, which is a slow death process where your blood loses its efficiency, your heart, to pump the blood to the distal extremities. So without oxygen, it dies, okay? So this is like true cellular regenerative medicine without hiring a $90 per hour nurse practitioner, without hiring a medical director that is making $1,500 a month. This is regenerative medicine in a box. Okay.
Yeah.
There's many different types of things we can use this for. But the thing that we're knocking it out of the park is osteoarthritis, general pain, inflammation, which is really the silent killer. And so anything with itis on it, right? That's inflammation. That's what we do really well with. And We've done it 700 times now. You know, success breeds success. And it's not like that you're going to be in that 1% club that fails, right? Because not everybody's knocked it out of the park, but out of the 700, we've had 15 clinics that were not able to do this. And that's the 1% club that you don't want to be in. So, I mean, I'm so excited because at Softwave, we're on a mission to end pain and suffering without drugs, without narcotics, without cortisone injections, without joint replacements. You know, it's each one of those is $1 billion, you know, industry. And we're disruptors. We're going to change that. And we're doing it every day. And these are just a list of the different groups. We're in 15 different professional sporting teams. I know Davide has helped us get into Tottenham, Premier Soccer League. And I believe Manchester is also, or is it Newcastle? Which one?
Yes, Newcastle up north. And then we are prospecting for some more football teams. And they're all very excited.
Listen, I'm a young man with attention deficit disorder. I was lucky to even get through chiropractic college because I've got a dyslexic brain. But I will tell you, I used to sit in chiropractic college and dream about working with professional athletes. It now happens. On my phone, every week, I have a different, either the Pittsburgh Steelers trainer or Miami Dolphins head trainer or the Dallas Cowboys training staff or the chiropractor for the Dallas Cowboys. They call me and they're like, hey, what do we do with this? And what do we do with that? It's like I'm living my dreams. And this technology has been the vehicle to help me get there, as well as many of my other doctors on this call today. So Harvard, Mayo Clinic, Cleveland Clinic, Baylor University. We're at Sloan Kettering. We're also at, Shepherd Spine Center, one of the top 10 rehab hospitals in the world for spinal cord injuries. So, yeah, I mean, it's effective, right? What I love most is the predictable patient outcomes. This is really a productivity and profitability increasing system. Not only does it get your patients well, and you get to take care of the tough cases that you don't have to refer out anymore, but it creates a financially stable clinic. And this is the cherry on the top, because what I'm noticing with our doctors is they're making an extra $27,000 per month. And I know you're like, oh, it's not about the money. And it's not. You know, what do they say? Money can't buy you happiness, but you can marry a chiropractor. That's what I always might tell my wife. But it creates stability in your clinic and allows you, like our clinic has 2 devices. I have 4 chiropractors, 1 nurse practitioner, and each one generates about $32,000 per month. We are 64% of our clinic is now cash-based. And 10 years ago, we were 99% insurance-based. And we used to run to the mailbox and like, oh, I hope the insurance gives us a check today. You know, and we were like sucking off that tit of the insurance company. And I don't have to anymore, because now we get over 120 Softwave patients per month. And Davide and his digital marketing team, they're one of the best on the planet at finding those people. This is consumer driven. This isn't because I'm a great educator. This is because patients, when they hear about this, they want to find it. And regenerative options that don't cost them an arm and a leg. And I will tell you, this in the hands of chiropractors makes us, as I refer to, as a non-invasive orthopedist with a focus on true cellular regenerative healing. Remember that. Okay, it's convenient, it's fast. The treatments are 3 to 4 minutes. Patients see near immediate relief. As you saw in that video I played earlier, this is that wow factor. That's after 1 session, except for Dr. Isaac Jones, who tore his ACL and went 14 months before he ended up having to have surgery. So this buys people time, right? It's not reversing stage 3 degeneration in a hip, but it's allowing people to live pain-free for the next 3 to 12 to 15 months before maybe they have to have surgery. But in a majority of those patients, they don't. So it is FDA cleared. Again, we spent over $25 million in the last 16 years on research and development. We're not some one-hit wonder. Maybe you're starting to hear about us, but we've been here. And, you know, it's been a long road. And you're going to hear more and more about us because we're going to change healthcare from bad to good. Because no matter what you say, there's still 1,000 people per week dying from prescription drug overdoses. That's like 3 jumbo jets going down a week. Like, you know, we wouldn't allow the aviation system to be up and running if that was happening. But for some reason, that is common practice in modern day medicine.
I think we were talking the other day as well, Dr. Matt, we were talking about how people, 95% of people on Google Trends, if you just go to Google and search, hey, trends.google.com, put in pain and put in chiropractor, you'll notice 95% of your community struggling with the chronic pain are not searching for chiropractors as a solution to that pain, which is a pretty alarming figure, which is what this device does really is it unlocks another 95% of your existing community that are suffering that had no other solution before. They were going to medication, they're like opioids, as you mentioned, they're going to surgeries, they're having cortisone injections, they're doing whatever they can, whatever they know is available to them. But now all of a sudden, with a device like this in their hand, with a device like this all across the US right now, people are finding an affordable solution to their pain. And I think that's a very exciting, ethical, powerful message to be able to send to our communities. And, you know, people are getting such great experiences from this. They're obviously going out and telling more people about it in their community and sharing it, aren't they?
Yeah, that really is. And it's supernatural healing. That's one of our patients tagged that. And I may have this, I'm not sure if this clip's going to come up. This is Dr. Martin O'Malley, foot and ankle specialist for the NFL and NBA. He's had it for 11 years. 10 plus 1 is 11. 11 years. And for the first 8 years, he didn't tell anyone. This was his secret weapon. I'm going to see if this plays. If not, I can send you the link.
Good afternoon. My name is Dr. Martin O'Malley. I'm an orthopedic surgeon. I practice at the Hospital for Special Surgery in New York. And also I'm a team physician for the Brooklyn Nets, the New York Giants, and for USA Basketball. I'm going to spend a few minutes talking about our experience with the Softwave technology from TRT Technologies. We first purchased our machine back in 2014, so we've had them for about 8 years. We started with one, but because the demand became so great, we had to purchase a second one, and we're quite happy with our results. I practice with 2 other orthopedic surgeons. We are all team doctors for different professional teams, and this is our office. And I'll show you our machines. So we go down to our office, and this is the most common thing that we use on a daily basis for non-operative care. It is the Softwave technology. The machine is pretty compact. It's easy to use. We can dial up the power on it, on the millijoules. It's the medical assistants or the PAs are the ones who actually perform the Softwave. We indicate the patients. They come back off and on in the operating room. The patients will have a whole list of shockwaves. We have shockwaves today. We have 5 shockwaves or 6 shockwaves. Pretty easy to use. A foot pedal, and you can dial the intensity to what indication you have. We've had great experience. We see a lot of plantar fasciitis, a lot of Achilles tendonitis. Those are our 2 main indications for. But any of the tendinopathy is very effective for. Also, because we do foot and ankle, we have some diabetic patients. We have diabetic wounds, and actually it's approved by the FDA for diabetic wounds. We've had some really remarkable studies for wound healing. You have to put a sterile cover over it, but in order to recruit stem cells and form new stem cells, the TRT technology is really good. The biggest advantage is really the Softwave technology. Because it's Softwave, it's a more diffuse wave, the patients can do it without anesthesia. Even though there's a CPT code for it, insurance doesn't reimburse for it, but we have no problem getting the patients to pay for it. The patients are very willing to pay to get better, and especially for technology that works. We published a study back in think it was 2020 in the Journal of Foot and Ankle Surgery, using Softwave unfocused technology, medium intensity for plantar fasciitis, and we had 85% success rate. So we're very happy with it. It's really part of our daily practice here at Sports Foot and Ankle. And I'm not sure how you can practice in 2022 as a sports medicine physician without using some sort of shockwave technology. It has a tremendous number of randomized control studies showing the technology works. And compared to the other devices, I think the TRT device is the most user-friendly and the most effective. Thank you.
Boom. Like, don't take it from me. I'm just my dad was a cobbler. I mean, I'm lucky to be a chiropractor. Like I said, take it from the foot and ankle specialist for the NBA and the NFL. That basically completes I'm going to stop sharing and escape. Can you see me okay? So that's our class for today. Davide, is there anything that I missed? Is there anything we need to touch on?
No, I think you touched on it there. Just to summarize, I think what I was hearing you say was, improve patient outcomes. It's super productive in that you're getting 5-minute treatment times. And then obviously, thirdly, you said it was like really profitable, right? It's $150 per session on average. Mm-hmm. So yeah, 3 times that of a normal chiropractic treatment. So obviously, this really does help practices grow their cash side of their practice. And I think that's, really fantastic. Thank you for everything you shared today.
Just a couple questions I see. Dr. Ronnie says, this is help with iliopsoas bursitis. If it has an itis on the end, yes, Ronnie, it does. Because that's inflammation, that's irritation. And that's why it's the billion-dollar technology, is that it's helping downregulate inflammation. And, I see some other guys. Is there any contraindications? If something has indications, then there are obviously contraindications. We'd never use this over fetal tissue. We'd never use this over a defibrillator or a pacemaker right now, even though there's no damage to the device. So we're not using it on the left shoulder of someone who has a pacemaker or defibrillator. We don't use it over an active form of cancer or tumor. And we wait 21 days after someone's had a cortisone injection. Cortisone, by the way, when I go to these international research symposiums, they look at us as barbaric, that we're still using cortisone in the States. There's 33 negative side effects. And do you know that a general surgeon will wait 3 months to do surgery after you've had a cortisone injection? Davide, ask why.
Because it's damaging their tissue.
Because it lowers the body's ability to heal. That's why they wait 3 months. We wait 3 weeks to get it out of the system. So those are the main contraindications. I avoid people who've had any type of tinnitus or ringing in the ears. That's the 5th one that I've added. But I mean, it's been phenomenal. And Dr. Gerald says, most amazing device I've seen in 27 years of practice, game changer, incredible results. He is not a paid actor by any means. He does own one. Josh Knighting, I had a just great interview with Dr. Knighting two weeks ago. I mean, this guy, not only did it transform his community and really boost his practice to very stable, but this guy lost 70 pounds. He's a rock star. He's part of my gang now. He's part of the elite Navy SEALs of healthcare. But there he is, my man, my brother from another mother.
What's up, Matt?
Not much, Josh.
No,
tell a
this
little
thing's
bit
awesome.
About, what has it done for your clinic in 3 years? And thanks for popping on.
No, sorry, I'm just in between treating patients and everything. No, I mean, we've got an 88-year-old guy that just took a fall down there. We're doing a Softwave for his first time, and he walks with a walker. He got up, and that pain's gone out of the hip. You can actually watch him walk and take steps like normal, even with the walker. But for me, this has really just helped to transform, my own self. I fixed my own ankle, my own knee issues. I'm 40 years old now and bought the thing almost 3 years ago. Bought it during COVID, and patients that can come in, there's something new for them. There's a new hope. There's new It's like you said, you don't have to go get surgery. You don't have to go get an injection. You don't have to go rely on pain pills anymore. It has transformed and allowed us to treat more hard to treat conditions besides just the typical musculoskeletal pain kind of stuff that we get to. But when we're not able to do it with an adjustment, what's the next step? We send them out. This has allowed me to keep them in and take that and really just transformed it. Like you talked about losing 70 pounds. I'm skiing, my quality of life has changed where I skied with the family all winter long, whereas normally I wouldn't even touch it. I'm stupid enough to go try a triathlon this year. So we'll see how that goes. And
what I said to you 3 years ago is you don't just need this for your patients and community. You need it for you. And I use it every 4 or 5 days, different part of my body. And I can't wait to share our regenerative protocol that's coming out. And this is why we sold this to a dozen regenerative medicine clinics and anti-aging clinics, because this is true cellular regenerative medicine for the working class person. Dr. David Harrison, I see him on the call. He's first in Michigan. I see Dr. Scott, who's just an amazing guy. Dr. Scott Perlman, who's a great educator. He's in my backyard and I sold a device to him. Ryan Weber, Dr. Weber is an amazing doc. Dr. Gerald has just done wonders. I'm up here at the house in New York. Dr. GB. So listen, I'm excited. This is more about navigating. You don't have to buy a device from us. I don't care. But understand, do your due diligence. Everyone out there is trying to tell you they've got the next best thing, that they're designed in Germany, when in fact they may be made in a Turkish facility. So look what you're doing. Find out what's the difference between the devices. The cream will rise to the top. And I want to thank everybody for taking time out of their busy day to work with us. I think we got all the questions. Davide, we did it, man. We're a good team.
Thank you for your time. I really appreciate that. If anybody wants to join the free CE, this is your chance to click the link in the chat, register there so that you can get on those free CE classes that'll be starting, hopefully, fingers crossed, end of April. We'll have our first couple classes. So looking forward to that. Please make sure you jump on to that link right now if you're going to, as we end this session, and go ahead and get yourself registered.
Thank you, sir. Have a great evening.
Thank you.